Yes, Chris, Walmart is abandoning its plan to build out a network of low cost health clinics due to the escalating costs and reimbursement challenges. According to Bloomberg, Walmart announced Tuesday that it will close all 51 health centers that it had opened in 5 states and also shutter its telehealth business. The company launched the initiative in 2019 and as recently as last year was promising to open more than 75 centers across the US by the end of this year, 2024. The clinics offered medical, dental, and behavioral health services ranging from x rays to deep teeth cleanings. Walmart declined to disclose how much money was invested into the business or the revenue generated from the ventures. Chris, I definitely jinxed this last week because I
Yeah,
was talking about the
you did. Yeah, I was
opportunity
gonna say
with
that.
Walmart's healthcare. What do you think of this move? What do you think's behind it?
I know that was so crazy. Like, remember last week I gave like the 5 growth initiatives for Walmart, and then you said, "Dan, don't forget about healthcare." And I was like, "You're right. That's number 6." And
Yeah.
it feels like they were just pumping the news on this like a few months ago, even like maybe 3 or 4 weeks ago, and now it's like full stop. So, um, I don't know. I'm saddened by it, but my hunch is there's a good reason for this because if you look at all those initiatives we talked about last week, so just as a reminder for those that maybe missed last week's show, Walmart's into banking, they're into digital marketplaces, they're into retail media. They've got Walmart Commerce Technologies, which is their own technology extension of what they do day in and day out. And so when I look at healthcare, it feels like the one that doesn't fit. And by that I mean there aren't the built-in synergies with the mainline business that
Right.
Walmart undertakes every single day with healthcare like there are with those other, I think 5, right? 5 that I mentioned. So because getting people, I mean, when you step back, like getting people to come to a Walmart for a doctor visit is an entirely new ask. And so
Right.
when I think about the sunk cost effect for the leadership of having to have the guts to say we're done with this initiative, we're going to pull the plug, it makes me think that Walmart saw no viably economic way for this to work. Like
Yeah.
that's my hunch. And so for that reason, I'm saddened by it because it makes me think if Walmart can't get this to work, who can? But
Yeah.
so it makes me think it could be the right business move, but time will tell. What
Yeah,
do you
I mean,
think though?
I think that it's really disappointing. I mean, I think
Yeah.
when I read this, that was the first thing that came to mind. But you're right, just because you you have the space in your stores or you have the capacity, you have a website that could also house telehealth and the commerce angles of this make so much sense doesn't mean that you have the infrastructure to support building a healthcare. But I mean, it's an entirely new vertical that Walmart has to go down. So it makes sense. I wish for the sake of the millions of Americans who live so close to a Walmart, who are already using Walmart as kind of their community center, the place where they can get so many things done in one place, the affordability that was provided with some of these healthcare services and convenience. I really, it's really disappointing that they weren't able to put more into this. But I think the bigger question then is like, what does this mean for CVS, Amazon, Costco, and others like
Mhm.
you started to talk about here, who've also gone down this path? I mean, just like grocery,
Yeah.
this is a replenishment kind of category. You consistently need a spot to go for these types of services. So, are we going to see others start to pull back on these initiatives, especially some that are so much more overt, like the CVS and Walgreens, who've kind of gone down this path? But not sure if you have any thoughts there that you'd
No.
close with. But I mean, that's really where I'm going to be watching. Kind of got to move forward.
No, I don't. I think we've seen that, the apex, the telehealth craze. And yeah, I mean, it was admirable the idea of $25 a month dental visits for the people that probably need them the most throughout the country, the 4,600 Walmarts that are out in the country. It's admirable. So yeah, in a lot of ways it's sad, but you can kind of understand it when you look at the scope of the landscape too. So